I'm so happy to be here today with Amy, mom of Ava, chatting about her unique experiences with her daughter on the spectrum, everything she's learned, and sharing her wisdom with all of you that are watching today. Welcome, Amy.
Thank you for having me.
Thanks for being here. Let's start with getting to know Ava. Can you tell us a little bit about who she is? What are her strengths? What she loves to do? And everything about her.
Sure. Ava is 8. She is the happiest, friendliest little girl anyone will ever meet. She's diagnosed with level 3 autism and a developmental disability. She is currently in grade 3, but in an MEDD room. And she's also in ABA 3 days a week, full time. She's starting to get to the age developmentally where she likes a lot of like little girly things. She asks me to paint her toenails. She wants glitter on them all the time. She likes princesses and
Love it.
Barbies. Yeah, it's a
I
lot
like
of
those
fun.
too. I love
Yeah,
glitter. Who doesn't love
me
glitter?
too. So it makes me so happy when she sticks her feet at me and says glitter.
Oh,
So
amazing.
yeah.
Yeah.
Yeah. Sometimes I get my nails done with glitter just, so we can connect because
Mhm.
she'll point at my nails and say glitter. So it makes me really happy that she's starting to have more age appropriate interests
Mhm.
and tries to connect with me through those things. Um, she doesn't really have any friends or anything yet. She just has some parallel play at school and at therapy. But I'm hoping that she'll get there because she's starting to have, again, more age appropriate interests.
Mhm.
But she still watches things like, Peppa Pig and Paw Patrol and whatnot on her tablets. But she's starting to get there, and it makes me really happy.
Amazing. Amazing. Um, she's got a lot of wonderful things in her life right now, too. Her school placement, she's able to access ABA treatment, which is remarkable.
Mhm.
And it sounds like a lot of that built the path
Yeah.
to what you're seeing now in terms of some of the successes. I love that you talked about connection with Ava. That's something that when I talk with parents early on in the diagnoses phases, can be challenging at times, right? How to connect with your child, figure out how to help best help them grow, learn new skills. These are all things that you've navigated with Ava over the
Mhm.
years to get to where she is today, which is really remarkable. So, in terms of that, Ava's got a lot of wonderful successes that you're seeing, and I'm sure you've seen along the way. But it took a lot of work to get there.
Yes. Mm.
And, thankfully, she's in this wonderful placement. She's got treatment. This is all amazing. Share a little bit about some of the journey in terms of educational placement, finding the right fit for the right treatment provider, and how that all worked for you, Ava, and your entire family.
Well, our journey to get where we are now started a long time ago before she was ever even diagnosed.
Mhm.
We were referred for a diagnosis at 18 months, and upon the pediatrician seeing her, they recommended right away that we started therapy. So we started floor time occupational
Mhm.
therapy, and because at that point she couldn't communicate at all with anybody. She would just walk around the room and like tap on walls, and her therapist would just follow her
Mhm.
and tap on walls. And that's how people would start to engage her. So we started therapy before she was ever even formally diagnosed. And when she was diagnosed a few months later, we got her on the list for the autism program.
Mhm.
We had her in Holland Blue Review's their preschool program
Okay.
while she was on the wait list for the OAP, as well as we did OT. And then she got into the Ontario Autism program, thankfully, right before uh, it was on a it was on freeze. So
Mhm. A lot of changes. Yeah.
yeah,
She got in, which is Lucky.
Very
Yeah,
lucky. It was
yeah.
frozen in June. She got in March.
Wow,
So just by the skin of our teeth, she
wow.
got in.
Yeah.
And thankfully, because she went through Holland Bloorview, which is a hospital
Mhm.
for children with disabilities, their preschool program, they have therapists there. So they had like SLPs, OTs, PTs. They teach them right away how to use PECs. So they do the picture exchange cards
Mhm.
for snack time, for everything. So as soon as she was enrolled there, she was using the PEC system.
Wow.
So
That's great.
when she started at ABA,
Mhm.
and she was there for 30 hours a week as soon as she started ABA, um, she was already using PECs. So she had a really great advantage there over most children,
Mhm.
fortunately. Um, to already know how to use PECs. So once she was there, because she was so strong with it, they had a SLP come and test her to see if she would be able to use a AAC device. And she was able to. So we got her LIMP, which is a program,
Mhm.
a speech program. And she used that for a few years and she learned how to speak very slowly, very
Yes, this is a
slowly.
journey to get
Yeah,
there.
yeah,
Absolutely. That's incredible.
yeah.
Um, for people watching, I think there's a couple really important things to highlight here. One is that in terms of communication and
Mhm.
perhaps some other areas, Ava has some profound needs in that area.
Yeah.
You got a diagnosis really early, which is, a
Mhm.
great step in the right direction. Doesn't always happen for people for a number of different reasons.
We're
Uh,
incredibly lucky for so many reasons to be able to access the things that we did.
Absolutely. And navigate the system
Yeah.
to, to figure out, okay, so here's where Ava's needs are, but the optimism and belief that Ava can learn.
Mhm.
And if we get her the right supports and treatment, intervention, whatever that looks like within the dynamics of her needs, then she can grow. And here you are getting PECS early. And for those that don't know, picture exchange communication system,
Mhm.
which is a wonderful step for individuals who are non-vocal
Mhm.
to help them communicate. And she was able to learn that and then get into a more intensive treatment, practice, these communication skills repeatedly, get a more sophisticated
Mhm.
device under all of those circumstances. And this doesn't always happen. It's important for people to know who
Yeah.
might be watching. But in Ava's case, it does happen sometimes, and it happened for Ava.
Yeah.
She started vocalizing.
Yeah. Ava's the exception and not the rule, the way everything happened.
Yeah.
We're incredibly lucky with what happened with her.
Yeah.
And she did so well and she continues to do so.
Amazing. Yeah. Luck, also navigation, persistence. Knowing you, Amy, I know you're persistent in terms of, finding the right treatment matches
Mhm.
for Ava. And then it's the work, right? She did a lot of work to get here herself.
She did a lot of work, and Bloorview. I never knew
Wonderful.
about Bloorview. The day after she was diagnosed, I Googled and I started calling around to see what I could do. And I found out about Bloorview, and they had a space. And I didn't know anything about PECs. I didn't know about any of these things. And they got her on a really great path
Hmm.
towards preparation for ABA. And yeah, I wouldn't have known about any of these things. But yeah, we were very, very fortunate.
Absolutely. That's great. Finding the right match. I think this gives hope for some parents that may be watching or even practitioners that may be
Mhm.
working with children who have more profound needs to start with,
Yeah.
to say that there are facilities
Yeah.
that people can look for
Mhm.
that help support the complexity of needs, right? And
Yeah.
that for individuals that do have profound needs in different areas,
Mhm.
look for those places that can
Yeah.
address needs across different areas. You also had great collaboration between professionals, it sounds like.
We did.
That's a great important ingredient here too.
It was so important.
You talk about speech, you're talking about ABA, there's an intersection there.
And
That's just
we
for
had OT.
communication. You've got
We
OT.
had everything.
That's wonderful, and that type of thing just highlights that experience highlights the need for customization for every child. When that happens, then you see the progress that every child I believe every child deserves,
Oh,
right?
for
In
sure.
terms of look where she is now
Mhm.
in terms of vocalizing. Now there's still steps
Yeah.
for her to learn and learning will go on for the rest of her life.
Mhm.
But right now she's in a place where she's learning the skills that she needs to learn.
Yeah. I never thought I would there were points I never thought I would hear her voice at all. And I mean, she's still considered largely
Mhm.
nonverbal, probably because she's not able to, go out into the world and
Yes.
conduct herself verbally. But there's a possibility she might get there one day,
Mhm.
and I'm happy about that. And I'm just happy she's gotten as far as she has now. To be
Yeah.
able to hear her voice is a beautiful thing.
Incredible. And even with the stuff that she's not able to vocalize, I always say no matter what, whether or not the child is able to vocalize or not, or
Mhm.
the adult, doesn't matter, that we should always empower them with some mode of communication, right? So she's
Absolutely.
got this AAC,
Mhm.
this assistive, communication device that can help support augmentation of communication,
Yeah.
which is amazing. Does she still use the device if she needs to, or is she able to go to the vocalizations, or how does that work for Ava?
Well, currently she's switching BCBAs, but she's going to be going back to using the device to support more growth in her
Hmm.
language. So they had been trying to rely on more verbal, but there's a lot of things that she can't say. She gets frustrated a lot. She can be very hard to
Hmm.
understand. So I'm pretty sure she's going back to trying to use the AAC
Hmm.
uh, more. But in places like at home, for quite a while now, she will just flat out refuse to use it. So it seems to
Yeah.
be like somewhere like school only, therapy only. She's willing to use
Yes.
devices, and then at home, she's just
She's got those
yeah,
associations.
she
Yeah.
will. Yeah, she's very rigid in a lot of ways. Like certain things, school only, therapy
Hmm.
only, me included. If I go to therapy for meetings and she sees me there, she will like physically try and push me out the door sometimes. Like, you don't belong here, you belong at home.
Yeah.
So she's yeah, if things are at therapy, they're only there.
Yes.
She's it's okay though, as long as she's able to make herself heard or understood outside of
Yes.
therapy or schools, and that's okay.
That's okay. This is an important message too. It Communication can be dynamic in
Mm,
terms of what it looks like for every child and what mode they use under different circumstances, right?
mhm,
And we have to be as practitioners, I think, flexible and responsive to the child's needs. So yes, she's vocalizing, but maybe there is some times where okay, it's harder to hear her or whatnot. We
mhm,
need to adjust our programming, consider how do we best empower Ava to communicate, right?
mhm.
And that might be on a certain path, and then we might have to be responsive to how she's doing and switch gears. That's okay too,
Mhm.
as long as everybody's working towards the common goal of her being able to express herself. And that's moving along, which is really remarkable. It's
Yeah.
amazing.
She will show people too if she's trying to I guess explain something to them or show them. Like for instance, my partner speaks Portuguese, and then one day out of nowhere, she just started watching Peppa Pig in Portuguese. It's like
Hmm.
I guess she's always been interested in watching shows in other languages.
Mm.
Then all of a sudden she just started watching her shows in Portuguese. And I said, "Where did you
Amazing.
understand that this was the language that he's speaking?" And then the other day, she just walked up to him with her tablet
Hmm.
and took his finger and like went to the drop down menu and pushed Portuguese with his finger, like to communicate with him, like,
Amazing.
look, this is what I'm doing. So sometimes she will take our hands, put them on things. Like she has a very deep and great understanding of a lot of things she just is not able to
Thank
verbalize. And even if she had Lamp
Yes.
with her, how does she verbalize, like,
Yes.
hey, this is your language and I know?
Yeah.
So, but she has a really great way to communicate.
That's amazing. And
Yeah.
that she's picking up on things in the environment
Yeah.
that you may have not been aware of.
Mhm.
And a lot of that is likely from the foundation that's been built, right? In
Mhm.
terms of those key foundational skills. Now she's, becoming more aware, more wants to be engaged
Mhm.
with her family,
Yeah, she
looking for
loves.
ways to
Mhm.
engage. That's wonderful. That's the connection back to that, common theme of looking to connect with the people that she loves, which is
Yes.
so beautiful. Glitter, Peppa Pig, English, Portuguese, it doesn't matter.
Yeah. Yeah,
That's
she asks for CP2 for all the time.
amazing.
And she'll sit there and like read the little things at the bottom of the screen or like she'll just
Yeah,
point to them to like show
incredible.
us what she's interested in, or like she's always trying to communicate with us in one way or another. It's really
Amazing.
it is amazing.
And we're talking about successes here, which are so important to celebrate, but it's not lost on me that I can imagine the amount of work that she's done, that your family's done in order to get her to be able to learn these critical things so
Mhm.
that she can connect with her world. Let's talk about school for a little bit. So she's in elementary school.
Yeah.
She goes to school every day. What does that look like for Ava? What's going well with school for her?
Well, she has a really great placement in a multiple exceptionalities room, which I had to fight very, very hard to get her. So again, it's unfortunately not a typical thing
Mhm.
because it should be. She is in school 2 days a week and in ABA therapy the other 3 days. But it's a great placement. There are 8 children in the class, and then 4 teachers. Well, one teacher and 3 EAs or ECEs. Um, and they do incredible work with her. And each of the days that she's there, she's integrated with the class that she should
Mm,
be in for her age. Um, and she's brought there with one of the ECEs from her classroom to do either music or jam, like something,
mhm.
that's easier to get through than if she was just sitting there, doing like math or something,
Yeah.
like something that's more social as well. Um, they've teamed her up with like a buddy in her class, her mainstream class. So she has to practice like a social thing to say hello or
Amazing.
goodbye with them, and they say hello and goodbye with her every time too. And I think that's really sweet, and that's really
Fantastic.
great for her too, because these people are relatively she's not so familiar with them because she doesn't see them very much. She might see them for an hour out of every week, but she has to
Mhm,
remember them and say hello and goodbye
mhm,
and practice greeting them and social things with them. And they pair them they pair her up with them, I think a different person every couple of weeks.
mhm.
So she has to get used to different
Great.
children, and it's going so well.
This is amazing. It's so wonderful to hear a story about success in the education system. Unfortunately, we don't get to hear a lot of those stories.
I know.
And there's a lot of challenges that families face in order to get their child the individualized needs met
Mhm.
within the education system. I find to be one of the challenges, again, because it's a spectrum and needs
Mhm.
so much vary across the spectrum. It can be hard for the system, the education system, to be adaptable to this. So here we have Ava, the right staffing in place. It sounds like for her. This is not the
Yeah.
case for
Yes.
every child on the spectrum
Mhm.
in terms of that particular ratio or that particular composite or that particular classroom. But for Ava and likely the kids in her classroom, this sounds like a really good fit. But then even
Yes.
beyond that integration and that peer mediated, that's our fancy term in our
Mhm.
world, for what's going on there in terms of getting peers to facilitate some of that learning
Yeah.
is just taking it up another level. And there's a consideration there for individualized needs and how
Mhm.
are we going to address her learning through that
Mhm.
individualized goals. This is like such a great composite of different pieces that have come together to really consider her educational needs. This is amazing, and I hope that people hear this to know that it's possible
It
for
is.
children, and whether that is a specialized classroom in terms of increased support, staffing support, because that's what Ava needs,
Mhm.
right? Given her where her challenges are, she needs the additional support to be able to learn. Or for some other kids that might look different, that might look as in full integration, and maybe there's at times they're pulled out for, individual learning on a given a topic or subject area. There's a huge spectrum, even in terms of educational needs.
Yeah.
This story of Ava and how she's doing is proof that it can be met,
Mhm.
because there's a lot of complexities here that are happening. And that's amazing
Mhm.
that you, as a family, with Ava, were able to get there, that you were able to find a placement that works for her.
Mhm.
What are some of the things that she's working on in school? So you mentioned the social.
Mhm.
She's got opportunities to integrate. This is
Mhm.
fantastic. What are some of the key things that she's working on that are important to her and you for school?
Well, school and therapy, I guess,
Hmm.
because they do work on a lot. Both of those things kind of overlap
Yes.
based on her age. Toileting is still an issue, so they work on that in both places. Printing, she has a lot of, I guess, fine motor skills,
Yeah.
things like tracing. Still, trying to learn how to print letters over, the little
Hmm. Like the tracing.
yeah, like the little pre-printed
Yes.
thingies. She's trying to learn how to do that. They've applied for her to have a computer at her school. Um, and she's seeing an OT and an SLP at school as well, like for
Hmm.
consultation to see how they can help her. Um, so those are a lot of the ways that she's struggling. Um, Things like waiting and stopping, which are obviously very common
Hmm.
for children like Ava. And obviously the speech and communication is still an issue. Eating, they are working in both places with her. They're able to try and introduce new things with her, like that maybe like a texture issue or a taste or preference issue, and maybe offering her a reward after, or like tablet time after, or preferred food after if she's willing to try it. Um, just anything that we seem to be struggling with at home
Hmm.
or outside the home, they're willing in both places to try and integrate those things there as well.
That's great. What's great about this is all the goals that you talked about: feeding, toileting, printing. Even the printing is doesn't fall under the traditional curriculum track
Yeah.
that people may think about when they think about school.
Hmm.
So this is really, again, an example of that individualization
Hmm.
for Ava, and also the intersection with ABA.
Yeah.
That's the ideal, right? For kids who are receiving ABA treatment and going to school, there's the opportunities there to collaborate together. I always say, so that when they're in ABA therapy, we're doing work so that they can benefit even more from school
Hmm.
ultimately,
Yeah.
right? So if we're all working together on common goals, at the end of the day, we're working towards kids being able to learn from the natural environment. This is really important. Sounds like that's happening here, which is fantastic.
Yeah.
Yeah.
Yeah. I
Yeah.
couldn't be happier with either of her placements.
Absolutely. That's great. You have a unique perspective as well in terms of the spectrum. Um, Ava's got two older siblings, and who also have been involved quite a bit with Ava too. I know
Mhm.
her oldest sister is
Mhm.
even interested in, how do I help best support people with special needs, which is amazing.
Mhm.
And also your schooling, and what you're interested in
Mhm.
within your own professional life. How does that all intersect and come together for Ava and your family in terms of helping her? And like, what have you all learned as a family unit, working together within the framework of ASD and greater special needs?
I think Ava has really changed our lives. Having Ava, I mean, myself, I've always been around autism. My youngest brother has Asperger's syndrome, and now he's 33 years old. He's married, has a daughter. He teaches English. He's doing amazing. And then my middle child is 15 and has level 1 autism. And he's also doing well with the appropriate supports that he
Mhm.
needs. Same school board as Ava, and they have also been wonderful with him. Um, and but everybody, once Ava was born, um, she was very different than my son and my brother. Um, she has required a lot more patience, a lot more empathy, a lot more understanding. And I have looked at the world through a completely different lens since having her. And I know she has affected our family in that way too. Um, Everyone is a lot more caring, I think, and looks at people with needs in a different way. Um, and I think has changed our paths a little more.
Mhm.
So, yeah, she's just changed our lives, and she's the light of everybody's life.
She glitters.
She is
She
no,
sparkles,
she
I
is,
mean.
she is, she
Yeah.
is. She's obsessed with glitter, but she
Yeah.
is. She's
Yeah.
like glitter. She's
Yeah.
always smiling
Yeah.
and laughing and giggling, and she is just like a giant ball of glitter.
Yeah.
Yeah,
Amazing. It's remarkable that you have experiences across the spectrum.
yeah.
It's unusual in the sense of, a lot of individuals may have experience with a particular aspect of the spectrum,
Hmm.
right? And it every a- anyone who has a diagnosis, by virtue of the diagnosis itself, is going to have needs that should be supported, potentially treated. It depends on what the needs are. But your experiences to be able to see, certainly for Ava, to see what she needs and for the family to be responsive
Hmm.
to her is very different than perhaps someone whose child may be able to go to school within a fully integrated classroom, for example, still potentially have needs if they have a diagnosis. What that looks like is very different. And for you to appreciate that is I think it's important for people to understand that depends on each child,
It
and
really
how do you
does.
navigate the system for each child can be so different.
It really does. I mean, when Ava was going through diagnosis, I was positive she was going to be diagnosed with
Mhm.
autism because I mean, my son and my brother, I had s- I was I'd seen a lot of similar things,
Mhm.
but Ava just seemed a little different. But when she was diagnosed with severe autism, that kind of like that took my breath away.
Mhm.
And I was terrified because I didn't know really what that meant. And I took the rest of that day, grieving and Googling. And then the next day I woke up and kind of got to work and tried to figure out what do I do now? Because it was terrifying to me. Like, what do I do? Like, to me, everything that I know the last thing you do is Google because Google's a terrible
Sure, yeah.
idea. But
But we all do it.
it, we do
I
all
mean,
do it.
yeah,
Um,
yeah,
but the idea of that diagnosis and what that
yes.
meant was terrifying. And for a while, I was like, no, the doctor must be wrong.
Mhm.
Like, it can't be. And as she started growing and developing, I started to realize, I guess the doctor is right. And because I see such a difference between her and my son and my brother, like night and day. The needs are night and day. Um, the symptoms are night and day.
Mhm.
Everything is completely different.
So different. It's important for people to hear this. And the other piece is that I don't think we talk about autism enough to begin with as a broader
Hmm.
community. So there's a piece there that I believe is lacking. But even a further enhanced piece, at least from the experiences that I've seen in terms of, let's say, mainstream media or just regular conversation. So from, a much more public facing, let's say TV shows or whatever it might be, down to just people having talks in the coffee shops with their friends or whomever. There's even less of a conversation about the kids who have more profound or severe autism,
Hmm.
and that's not being a part of the conversation for you. So for you as a mom to try to figure all that out and figure out how can I get Ava what she needs? Because that's what it is at the end of the day. To me, I say, well, the labels are labels, but
Mm,
it's about getting a child, the opportunity to learn, the opportunity to live their best life.
right.
So having gone through that, and because again, I don't think we talk about profound needs enough. What perspective would you share with other parents who may have children who have, more significant needs or challenges in any given areas, whatever that may look like for that child? What would you tell them having gone through that journey?
Well, I think parents who have children with more significant or more severe autism can appreciate how devastating just everyday things can feel sometimes. Um, Whereas I don't feel like I experienced that with my son. He also doesn't have a developmental disability, so I'm sure that comes into play in some areas with my daughter. Um, but the way that media presents autism, as you were saying, that really misleads a lot of people to believing that's what autism is.
Mhm.
I'm just finishing a medical program in college, and when autism came up, that's immediately what everybody thought autism was too. And
Mhm.
I explained to my class, no, that's not what autism
Mhm.
is. Autism is not cute and quirky and funny in a lot of ways. It can be, you know, very messy and self injurious. And sometimes some of the things that you see, you would not realize is autism.
Mhm.
Um, it can be adult patients that you have in diapers. They can have autism. Like you would not know this based on what you see, in some of our medical literature or, out and about based on what you are presented with in media. And when I thought that was autism based on my son
Sure.
and my brother and what I always saw on TV after, researching severe autism and everything, I was terrified. And then once I started living it, it can be heartbreaking. Just sometimes I forget my daughter's actual age until I see other
Mm.
kids her age. And it's like, oh, that's what 8-year-olds are doing? Because my older children are so much older than her.
Yes.
We have a family member who has, he's like the cutest, sweetest little, he just turned 1 and he's doing all the things that 1-year-olds should be doing. He's so bright and he communicates so well. And sometimes I'm so taken aback. It's like how old Ava was when she
Mhm.
finally started to do that, or how many hours and thousands of dollars it took in OT to teach her how to point. It's like
Yeah.
things like that can be devastating. We were at a wedding recently, and uh, during the father daughter dance, I just started breaking down crying out of nowhere because it's like, I don't think my daughter's going to do that.
Mhm.
And it's like sometimes severe autism just hits you when you aren't even expecting it, like during happy moments like that. When I'm watching that baby, he brings me so much joy and I love him. And sometimes it hits you when you're not even thinking about it, or at that wedding. I wasn't thinking about Ava in any of those times. And sometimes it's just like
Yeah.
it hits you.
Thank you for having the courage to share that. It's so important for people to hear the different perspectives of autism, right? And the
Yeah.
experiences that you've had. I've never heard of someone describe it like that. Just hits you in the most unexpected moments.
Yeah.
Yeah, it's just it's a different journey.
It is. I didn't expect to
Yeah.
be crying at a
Yeah.
wedding like that. Usually, you're crying during the ceremony, like, oh,
Yes.
that's so cute.
Yeah.
And then just out of nowhere, I just started crying and
Yeah.
I know I felt so stupid, but it's just like, my partner was like, why are you crying? And it's just like, Ava.
Yeah. It's real.
Yeah, it
It's
just
real.
gets you randomly.
And, I mean, look, every different individual's experience on the spectrum is their experience, right? And then
Yeah.
their needs are their needs. And like I, mentioned, there's a reason why there's the diagnosis to begin with, no matter where they fall on the spectrum.
Mhm.
But it's important to have these
Mhm.
conversations that you're sharing, your experiences, and to talk about the reality of this
Mhm.
and why I feel that it's important. There's a number of different reasons, but for me as a clinician, one of the reasons is okay, because if we can have these real conversations about these experiences and what matters for Ava, for Amy as mom, and the greater community, it means that we can then be in a position to do something to empower Ava, to empower you as a family. If it's not in the textbook, this is a great example, or if you're in your medical program and you guys aren't talking about the realness of the entire spectrum, but only a sliver of the spectrum, then
Mhm.
how can you possibly help people in healthcare
That's
who
the
have the
problem.
different needs, right? And
Mhm.
so to be able to bring that to light through your experiences is so important for people to hear. Because what are we going to do about it? If we don't even know it exists, if we can't even have the conversation
Yeah.
about these needs and about these experiences, how are we going to be in a position to do something about it? So your story is so important for people to hear and understand, and many other, and for parents who are living it themselves to know that they're not alone is really important. A piece of that story is the education that you've gone through yourself for your career and your profession. How has that shaped you in terms of the perspective that you bring, having Ava in your life, and where do you see healthcare in terms of where it can be done better for individuals on the spectrum? What can we do better in terms of healthcare, servicing individuals with a variety of needs, including complex needs? What do we need to do?
Well, first of all, I'm sure anybody who has a child with autism, regardless of the level, realizes what a barrier there is to services
Mhm.
in healthcare. And upon going to school, uh, my textbooks have such old information, old, outdated information. And I'm learning from the newest textbook, the only textbook that exists for my program in the country. So anyone going through my program is learning the same
Mhm.
outdated knowledge, and that's a problem.
Mhm.
So I wrote to the publisher. I complained to my MPP because it's a government funded program.
Mhm.
I mean, we're creating a bigger problem because we're teaching people who are going to be working in the healthcare field inaccurate information. So we're just making a bigger problem worse. So to me, that's a problem. We could start with teaching from accurate material
Yeah.
in the first place. And I know I have a friend who's a nurse, and she was saying that it wasn't until um, she has a stepbrother who has a disability, and it wasn't until she learned through him, life experience with
Mhm.
him, how to treat people with disabilities properly. It wasn't in school. Nothing like that. Like, we aren't teaching people in school before they even are out in the field working how to work with people with disabilities. And there are so many people out there. I think the statistics are like something like 20% of people at some point in their lives will end up with a disability. That is a lot of people.
Mhm.
We need to focus a lot more in education of healthcare workers, how to identify the needs of people with disabilities and how to treat them, especially non speaking people,
Mhm.
and to listen to their caregivers. Because I feel like a lot of times,
Very good.
especially if it's a
Mhm.
non speaking person, people just would brush off the caregivers. They're not interested in listening, or they think that we're overreacting, or I guess like because people are crunched for time in healthcare,
Yes.
especially they rush you with the room, so they don't really listen to all the symptoms accurately or really look you over. It's just there are so many issues in
Yeah.
healthcare.
And what it comes down to is something that you raised that's really important to consider is that if we don't integrate the needs of individuals with a variety of different disabilities into healthcare, then there's limited access to healthcare. They
Yeah.
can't access healthcare, which then creates this like snowball effect
Mhm.
in by which the healthcare needs become more profound,
Yeah.
right? Across the board. I mean, just, as one example that I've seen, even let's say going to the dentist, right? We've got kids on the
Yeah.
spectrum that have a really hard time, and not just kids, youth, adults, even on the
Mhm.
spectrum that have a really hard time going to the dentist. And so, and for because there's it in some places, there's no ways to facilitate them getting into the dentist, getting checked, even just for a regular checkup. What ends up happening? Well, needs become more profound.
Mm.
And then all of a sudden, they have to be put under
Yeah.
for something that could have been prevented
Mm.
had they been able to access going to the dentist regularly. And that's the dent, not just that's a serious issue with the
Yeah.
dentist. It gets magnified across the entire healthcare field, right?
Yeah.
And it starts with education, as you mentioned,
Yeah.
people within the healthcare sector understanding and being educated.
Mm.
Listening, I love that. Listening to the to the caregivers as well, particularly if we are treating individuals that maybe
Mhm.
can't describe their needs or, say that something's really going to bother them or they need a couple minutes or whatever that might look like for that individual, that this is really a tough situation and what makes it tough. So caregivers are in a position to do so. So we've got to give you guys time. And it's the
Mhm.
time. I do think you're right about that.
Yeah.
If we're just getting people in and out, in and out, in and out, okay, there's no ability to even sit down and figure out how do we best have this experience for
Mhm.
this individual. These are
Yeah.
these are really important considerations and how we can do better.
That's a big problem for my daughter. Like a lot of the time, if you ask her a question, she'll just be like, "Yeah, yeah."
Hmm.
She doesn't know how to answer a question or identify if something's really wrong with her. Like she's been really sick, and if I ask her, does your throat hurt? Yeah. Does your stomach hurt? Yeah. Is your elbow green with purple polka dots? Yeah. Like you can't get
Right.
an answer out of her. So if I take her to a doctor, they need to really examine her to get an idea of what's wrong with her.
Yes.
So, but if they're rushing everybody out the room in like assembly line fashion, they're not gonna find out.
And the problem can potentially get worse.
Yeah.
And that is very costly on our healthcare system. Never mind the
Mhm.
human side. There's a human side to this too. And I
Mhm.
believe we need to treat individuals with special needs, autism included, better. They deserve it. Every individual deserves it.
Mhm.
But then there's also a cost aspect here too, where I've seen these things snowball into much larger issues than
Yeah.
they ever needed to be if
Yeah.
we could just spend the time and figure out the best way to have, us help individuals access healthcare.
Yeah.
It starts with the textbook, Amy. What you noticed, the textbook is missing information and then it moves from there.
Yeah.
Having subject matter experts like yourself too. Amazing. Of course you called the publisher to say, good for you, to say,
Well, I mean,
guys,
come
like
on.
something's missing here.
Yeah.
Yeah, we
Yeah.
need to be able to have these conversations. Absolutely. Good for
Mhm.
you. And good for you for bringing that perspective to your class. We need to figure out how to fix this system wide too.
We do. And
Yeah.
I think a lot of the conversation starts with caregivers, and politicians need to listen to them.
Hmm. Absolutely. Healthcare, education, there's
Mhm.
a lot of layers here.
Yeah.
In terms of ABA, Ava's accessing ABA. So
Mhm.
we've talked about her needs. We've also talked about her successes
Mhm.
and recognizing the needs and working towards that to make those successes is
Mhm.
incredible. An aspect to that for Ava is ABA.
Mhm.
Amazing. What are some of the things that you are most proud of that Ava has learned through ABA?
Well, I'd say her speech
Hmm.
is a big, big one. And being able to take her in public, because for a long time I thought I was going to be stuck inside with her forever. And it is amazing to be able to take her anywhere now because watching her experience the world is just, it brings me so much joy. Um, I mean, she doesn't necessarily have a lot to say, but she likes to say Wonderland because that's one of her favorite places, and Trip because
Yeah.
Trip for her means Great Wolf Lodge because she's obsessed with water
Amazing.
parks. So hearing her be able to request those things, even though obviously I can't honor them
Yeah.
every day,
No.
like she
Yeah.
asks me
Yeah.
to, it brings me so much joy because we are
Yeah.
able to do those things, or you know, Walmart winners, any she asks for any place that she can say or read, you know,
Yeah.
at the store. Um, but she can go and she can do those things. I mean, she can't necessarily wait in lines or anything, but
Mhm.
thankfully, there are a lot of places that offer things to help the visits be a little more accessible, like at places like Wonderland.
Mhm.
Um, but just to be able to take her out into the world is amazing. And it makes me so happy to watch her experiencing life
Yes.
just like someone who's more typical. I mean, obviously, she needs a little assistance
Mhm.
to make that possible, but just to watch her enjoy life, just it fills my soul.
Just hearing it fills my
Yeah.
soul. That's so wonderful. What a beautiful gift ABA gave to
Yeah.
your family. This is remarkable and a meaningful life change. This is not
Yeah.
traditionally some people think, oh, ABA does, you sit at a table and
Hmm.
do a bunch of
No,
drills,
no.
we've so progressed beyond that. And this is a perfect example of
Mhm.
this. It is also your experience is so profound for people to hear that you thought you would never be able to take her anywhere, that you guys would basically be at home all
Yeah.
of the time prior to her accessing treatment. I don't think the average person would appreciate that this is a potential experience. And it is
Hmm.
not even a potential. For other families, this is an experience.
Hmm.
Let's talk about families who have not had the opportunity for their children to access
Yeah.
treatment. This is a reality. I hear this from families.
Yeah.
They really can't really leave their home.
Oh,
Their children experience and youth and even adults experience such challenges that they can't leave their home. It's unimaginable to me and it's unconscionable. No, this should not happen with any family. And some people may say, well, you know what? If they don't want to leave, it's okay. You got to let them be. But look at Ava in terms of by working through that. And I'm sure we'll talk about this a little bit. I'm sure, there was a journey to
Mhm.
get through that. But by getting through that, she was able to experience all these wonderful things. You were
Mhm.
able to experience them with her, like Wonderland and
Mhm.
Great Wolf Lodge. And now she's asking for this
Yeah.
stuff.
And it's a real motivator for her for everyday things. You know what I mean? It's like
Yeah.
if she doesn't want to go to bed, if she doesn't want to settle down, it's like, Ava,
Yeah.
do you want to do these? You know what I mean?
Yes,
These are
that's
how we do
right.
these things. We use first then for everything. So it's a good
Yes.
motivator for her to want to do things. And for us to not leave the house before. It was because, well, it was even dangerous being in the house because her behavior was so
Mm,
dangerous. We had window locks, we had door locks. She was always trying to escape everything. Like she was a big flight risk before.
mm,
So that was a big part of leaving the house. Um, but they have a walking program where she does ABA.
mhm.
So there were a lot of things that helped us get to the point where we can now leave the house.
Amazing. Safely.
Yeah.
This is amazing. Yeah. So, what were some of those things? What was that journey? This is a huge success for Ava and your family,
Mhm.
and you as mom was committed to this too.
Mhm.
This is a journey. So we're gonna work through this. Ava gets to so Ava can experience life and all the joys that come along with all these different places that she can go to. What were some of the things that you guys worked on to get there? You're walking, safety sounds number one.
Yeah.
Yeah. Other things that you guys worked on to be able to get to the different places and do things.
Like to take her out the house and whatnot.
Mm-hmm.
Well,
Yeah.
first we stayed close to home.
Yeah.
Of course,
Very good.
there
Yeah.
was a little park right beside where we live, and that was pretty much as far as I would ever venture out before on my own because I don't drive. So I was not willing to take her anywhere like on a bus or a
Mm-hmm.
train or anything because that potentially was really dangerous. So I had to stay right next door at the park where it was somewhere. It was a big open space. So if she ran, it would take her a lot to run anywhere to a road. So that was about as far as we could go for a while. And then we moved on to going on the little walks around the neighborhood.
Mm-hmm.
You know, me holding on to her. I couldn't hold her hand because she would always just slip out. I'd have to hold her by the wrist.
Mm-hmm.
And we go on walks around the neighborhood. And then we progressed to being able to go into stores, and stores were difficult. They still can be difficult sometimes because to get her to leave a preferred
Mm-hmm.
section, which for her is books. She loves books. Um, can be difficult
Okay.
sometimes, but as long as, we set a timer or we give her reminders, she can be okay with leaving. Um, and then we just kept progressing and kept progressing. And a lot of this actually that we worked on was over the pandemic,
Wow.
because we couldn't really go anywhere.
Yeah.
So we just, you know, played outside and we kept walking.
Mhm.
Um, and then we slowly progressed to, I was able to take her on the bus, on the subway. She loves the subway. And now I can reasonably take her just about anywhere.
Wow.
Yeah.
That's amazing. Stepwise approach. This
Yeah.
is one of the, hallmarks of
Yeah.
ABA, right?
Yeah.
Is
Step
breaking it
by step.
down into small steps. What those steps look like
Hmm.
for each child can be very different, and it should be, because
Hmm.
we got to think about, where do we start? I sometimes I talk about it like the high jump. It's like you got to set the bar just a little bit higher from where
Yeah.
the capabilities are, right? So you don't want to set it too high, so that, if the skills aren't there,
Hmm.
she's never going to make that jump.
For
But
sure.
if we make it a little bit higher than where her skills are right now, within reason, like here you've got to think about safety considerations, you got to think
Hmm.
about a bunch of stuff, but so much just a little bit higher, such that we're teaching but she can meet success, then we
Hmm.
can keep, progressing in terms of steps. This is a
Hmm.
great example. Going to a local park that's safe is a great first step,
Hmm.
right?
And her BCBA had recommended to me when I started taking her on the bus, for example,
Hmm.
like that a great thing for her to do was visuals, obviously. And
Hmm.
like when she was at therapy, like write lists or like a whiteboard and like cross each one out as we do them. So when I take
Yes.
her on the bus, like on the bus, cross it out. Next is the train. And like, so she could
Yes.
see each thing because she always needs to know what is next. Like first this, then.
Yes.
And she will tell me in the evenings, for example, like if she has her shower, first shower, then bedtime, or first bedtime, then therapy. Like she tells me her own schedule. She's very schedule oriented.
Yes.
So we need to tell her what we're doing as we're doing it. And that really helped her, especially to see it.
Amazing. Adding some element of predictability for her
Yeah.
so that she could see it and not just say it.
Hmm.
Because sometimes for some kids, it's just saying it can be too transient, right?
Yes.
Just, okay, I heard it and then it goes away. But to see it outlined, the steps, to have some kind of visual support that makes sense for that child. And
Hmm.
then to meet the success, the reinforcer, sometimes I call the party, right? All
Hmm.
these good things happen
Yeah.
when you work towards those steps. And for her to experience that enables you to keep raising that bar.
Yeah.
This is amazing. And Ava to experience these wonderful things in life that she wouldn't be able to experience otherwise.
the
Amazing.
the last time we took her for a haircut, she asked us where we were going,
Uh-huh.
and she Googled it and looked at the pictures of where we were going so she could see.
Great.
She always needs to know.
Yes. Yeah.
But yeah, if you
And fair
tell her,
enough.
yeah,
Yeah. It makes, we all like to be able to know what's coming. And,
yeah,
she's getting older too. So to be able to exert that sort of her own element of control over her life, right?
mhm,
She deserves to be able to do that. To, okay, I've got to figure out where I'm going. Let me like prepare mentally for whatever that means for her, right?
mhm,
Okay, I'm going here, Googling it. Perfect. See, we
yeah.
all Google. It's all good.
She Google images everything.
Yeah. And that
Everything.
works for her.
Yeah.
It helps her meet success in
Mhm.
her life, which is fantastic. Amazing, just remarkable. Having gone through the journey with Ava, with your family, the challenges that you guys have as a family faced and overcome is beautiful, and it's so optimistic for people to hear. And also your authenticity and the realness of the experience is, I think, just so important for the community to understand. Going through all of that, what do you want the community at large, society, to know about kids who have more profound needs like Ava? What do you want people to know? This is your chance to share. This is your textbook. What would you say? What would you write in that textbook?
Well, I mean, I wish that the media, for instance, would portray autism in I shouldn't say a more accurate way, but have more accurate representation
Mm,
show that people with more severe and more profound autism do exist. So people could have a better idea of what that looks like. Because I think there are a lot of people out there who have severe autism, and people have no idea what that is. When they see them out and about in public, people have no idea what that is, how to approach them, if they should approach them. Should I be afraid of that person? A lot of people have the assumption that people who have severe autism aren't necessarily loving or affectionate, and those things aren't always true.
mm,
Sometimes they can be very loving and very affectionate. Um, I think that unfortunately, there are way too many barriers when it comes to school, accessing therapy, accessing healthcare, basically accessing anything, even housing
mhm,
for people with disabilities, especially something like autism. Um, but those things can happen. Unfortunately, a lot of the time they require money. And we were very fortunate. Sounds terrible because it's not a fortunate situation, but my mother passed away right before Ava was born. So I was able to sell her house and provide Ava with therapy, but that shouldn't happen. But
that should not be what it takes.
no,
Yeah,
but
absolutely.
how many times have you heard those stories?
Mhm.
Everyone sells their house to pay for therapy.
Way too many times. It's
Yeah.
tragic, absolutely. Accessibility across the board is an issue.
Yeah, and
Absolutely.
that's the thing. Accessibility is
Yeah.
an issue uh, when it comes to just about everything with autism. Um, but persistence is key. If you aren't happy
Mhm,
with, with your provider, with your school board, with uh, anything,
mhm,
everyone has a boss. Even your politicians,
mhm,
you're their boss.
mhm.
So don't stop.
That's
I
beautiful.
Yeah, and you have to do what you have to do to get
Very true.
services.
Amazing. Accurate representation, accessibility, persistence. These could three things could be game changers within our society as a whole, help all kids live their best life.
Yeah.
Thank you for sharing your authentic, optimistic, hopeful story with us.
Thank you for having me.
It starts with accurate representation like this, and I appreciate you having the courage to share it with all of us today. Thanks, Amy.
Thanks.